Healthcare providers these days have many different certifications over many different platforms that they have to complete these requirements for. Our platform brings it all together in one place, managing all of the timelines and offering those healthcare providers the right education at the right place at the right time.
Mocingbird is a community. It's a platform that people join who work in the healthcare force, and it is used to improve one's life, one's ability to take care of patients, and one's ability to educate themselves so that they can keep performing their calling.
What I think that we bring to this platform as having two physicians starting this company and starting this platform is that we recognize the problem from the inside out. And we've developed a platform that's through the lens, through the eyes of a healthcare provider.
Mocingbird takes a career burden and brings it down to about 20 minutes. For 20 minutes, you need to gather all your certifications, all your current continuing medical education, and you need to literally just place it, drop it into the program. From there, we take care of everything else.
There's so many requirements placed on these very busy individuals, professionals, and we've built the platform with them in mind. So every decision we make is this going to have a positive impact on the physician? We've developed the platform and the product and continue to develop the platform and product, not to create an additional task, but to make it fit within the very busy lives and that the professionals have. So whether you're on the subway, whether you're in the car, whether you're at at lunch, whether you're between cases, you can easily get to our site on your phone, on your laptop. You can consume content. You can actually get CME credits.
We built a platform that a provider is, first of all, more interested in consuming. We deliver it to when they have the time to consume it in a format that is easy for them to consume. And at the same time, provide them education that is very relevant to them at their fingertips.
A lot of people talk about physician burnout, but it's more than just docs. It's our nurses, our nurse practitioners, physician assistants, physical therapists. People are becoming burnt out in the system because of the pressure that's on them. Giving them a platform that gives them time back is going to help them enjoy the work they do and engage in patient care in a more meaningful way.
Mocingbird has an opportunity to revolutionize healthcare education.